Good morning. How was your on-call night?
Good morning, Dr. Sawala. Our call night was very busy. We admitted 4 patients.
Well, this is a good teaching experience. The more patients you see, the more experience you get.
Can we start rounding?
Yes, can you please present the new patients first?
Our first patient is Mr. Smith. He presented with nausea, vomiting, headache, mental status changes, stiff neck and fever. He has a past medical history of heart disease. He also told me he has central chest pain. I think he has gastroenteritis.
What did you find on physical exam?
Oh well, we did a CAT scan.
How about his physical examination, doctor?
It was okay. I was very busy admitting another patient. I did not get a chance to examine him, but the intern said the exam was okay. But as I told you, we did a CAT scan.
Okay, how about his EKG?
I am sure it was okay.
Did you look at it?
No, but I am sure the ER doctor looked at it.
But this patient has chest pain. I want to make sure he does not have a heart attack. Can I please see his EKG?
Okay, if you insist, I will look for it.
Thank you.
I don't find it, Dr. Sawala. I have been on call all night and now you want to see the EKG. Can we move on to the next patient?
I need to make sure Mr. Smith EKG is okay. I'm surprised you did not look at his EKG.
I told you it was a busy call, and we admitted 4 patients. Can we talk about the second patient?
No, I need to see the EKG first.
Do you want me to continue to look for it and waste more time, or should I start presenting the second patient? Maybe the EKG was not done. I have to go home according to the new residency regulations.
I don't think this is acceptable medical care. I need to see the EKG.
I will order one before I go home. The house officer can check it. Can we talk about the next patient?
Tell me first, what is your differential diagnosis for the chest pain in this patient?
According to residency regulations, you are not supposed to do any teaching when we are post-call. I need to go home.
But this is the best time for you and the medical students to learn.
I don't care. I admitted 4 patients. It was a very busy night, and I need to go home.
I'm aware of the new work hours for residents.
Do you want me to present the second patient, Dr. Sawala?
How about the lumbar puncture results for Mr. Smith? Did it show meningitis?
I did not do a lumbar puncture for him.
Why not? He presented with fever, headache and stiff neck. This can be meningitis.
I did not think so. He has gastroenteritis. Now excuse me, I have a call on my cell phone. So, what were you saying before my private phone call, Dr. Sawala?
I think the patient needs a lumbar puncture.
Okay. But I have never done a lumbar puncture before.
Why? How come you are a second-year resident and never done a lumbar puncture?
Because, when I was an intern, we never did a lumbar puncture. According to the residency regulations, I don't have to do a complete patient workup. I just have to leave the hospital on time.
Okay, well, I know about another patient who is coming tomorrow for a routine lumbar puncture, and I can arrange for you to do that.
Sorry, Dr. Sawala, I can't do it. Tomorrow is my day off. According to the residency regulations, you have to supervise the intern tomorrow and admit all the patients. So you can do the lumbar puncture yourself. You can also do the lumbar puncture for Mr. Smith today, if you want to, since I don't know how to do it.
Maybe I can show you how to do it, since you never done one before. Or you can ask one of your other colleagues to help you, so you learn how to do it.
I can't do that. I have to leave the hospital on time. Now excuse me, I have another call on my cell phone from my best friend.
Can we finish talking about our patients, and can you turn your cell phone off during rounds?
What do you mean, turn my cell phone off? I get important work-related call.
During rounds I want full attention. You are here to learn.
Can I go home now? According to the residency regulations, I should go home now.
How about the patients you admitted?
The house officer on call will take care of them. They will call you if they have any questions. Of course, I will turn my pager off.
Residency is tough nowadays.
Yes, I admitted 4 patients. Tomorrow is my day off, and I don't know if Mr. Smith has meningitis or heart attack, but I am sure you will discharge him by the time I get back.
But don't you want to know what happens to your patients, and if your diagnosis is correct?
No, according to the residency regulations, I don't have to know anything. I just have to make sure I go home on time and take my days off. I had a very busy night. I admitted 4 patients. Also, I want to remind you that, as the attending physician, you need to come admit patients tomorrow with the intern, because tomorrow is my day off, according to the residency regulations. If the intern caps, you need to admit patient by yourself, Dr. Sawala. This is the new residency regulations.
No wonder why you did not get enough procedures done. Are we really making better doctors and improving patient safety by these residency regulations? Enjoy your day off, doctor.